delayed diagnosis of B12 deficiency, which is unacceptable. Unacceptable in 2000, even 1990 or 1980s. Unacceptable.
Let's talk about the lack of universally accepted screening protocols and what you're suggesting.
Well, I suggest that anybody who is symptomatic, and symptomatic means, B12 deficiency, we've known this for decades, for 100 years. It causes neurologic signs and symptoms, psychiatric symptoms, and blood or hematologic signs and symptoms. And the reason that is because B12 is needed for that myelin. So the classic symptoms since the 1900s, we know is it causes paresthesias, like I mentioned before. So numbness and tingling to the hands or feet, weakness of the legs, arms, or trunk, abnormal reflexes when a doctor uses a reflex hammer, unsteady or abnormal gait. You can have balance problems, dizziness, tremor, difficulty ambulating. Some of these are later signs.
How about fatigue?
Okay, now that's more of the blood signs. So the hematologic signs are generalized weakness, like all over, fatigue. You can get short of breath. People become anemic. But you do not have to be anemic, because what we've learned, if you go back and look at articles in the early 1900s, and even in the late 1800s, and even in the early part of the century, the neuropsychiatric manifestations, which is the nerve and the brain, well precede the blood picture. So before the blood becomes anemic, or before the people get macrocytic, the blood cells get enlarged, they have these neural signs and symptoms first. And the reason why, so you can't go by the traditional name pernicious anemia. That's what physicians are looking for. For them to think B12 deficiency, they're looking for anemia. That's one of the reasons they're missing it. But you don't have to be anemic. And what we're learning, if you wait till they get severely anemic, you can have permanent nerve damage. That's what we're trying to prevent. So the number one thing is we need to re-educate physicians, clinicians, healthcare institutions like nursing homes, what the signs and symptoms of B12 deficiency are, and have to, even though we've kept that name for just tradition, it's kind of adding to the confusion and diagnosing patients late.
My mother had Alzheimer's and passed away in 2008, and in the later few years, she was in Sunrise Assisted Living. And a few months before she passed, she fell. And then I became interested in how many people, once they fall, die very soon afterward for some reason. By the way, in the anti-aging realm, B12 has been overlooked.
Oh, and it doesn't even make sense, because it's kind of funny, when I used, for the last 2 decades, when I would want people to be tested, they go, oh, that's an old person's disease. Just like my hematologist back in the 80s and he was a hematologist for 20 years, said, oh, that's an old person's disease. I was like, I think when I went to him, I was like 24, 25. He was like, he just completely dismissed it. So they know it's an old person's disease. The signs and symptoms of normal aging and the signs and symptoms of a true B12 deficiency are identical. Therefore, you're not going to know. Just like when you screen for, we can't tell by looking at someone if they have diabetes or thyroid disorder. You have to test them, okay? They have symptoms. They may have symptoms of increased thirst, urinating all the time, like for diabetes, et cetera, okay, or for hypothyroidism if you're tired. But we can't put our hand on you and say, oh, you have this or that. That's why we do testing. That's why we screen them. Or even for cholesterol, we screen you for it. We don't know. All we're asking is the same for B12 deficiency. Screen people who are at risk. Anybody who's symptomatic, you have to screen for it. Just like if a diabetic came in and complaining of increased thirst, urination, tired, we wouldn't test them for diabetes? Of course we would. So why aren't we doing this for B12 deficiency? Especially when you can cause nerve injury, it is related to fall-related trauma, you can cause cognitive decline and dementia. Why wouldn't you test for it?
Well, here's my question. Why wait for anything symptomatic? Why can't it be a part of something we always test for?
It should. That's what we're trying to do. We can't even get them to test symptomatic patients, let alone putting it in a protocol. This is what you test for. So yes, it should be, absolutely. And the people who are at risk and who to test would be anybody with neurologic or motor signs or symptoms, mental status changes, anybody with a suspicion of dementia or even the diagnosis of Alzheimer's disease always should be checked, anybody with psychiatric disorders, and a lot of people don't realize that anybody who has depression or on an antidepressant, that's included under psychiatric disorders. So anybody with depression, anybody with gastrointestinal disorders, gastrointestinal surgeries, people who are very high at risk are patients who have gastric bypass who are overweight. They're going to get B12 deficiency. Why? You have to have a healthy functioning stomach to absorb B12. So in time, they will become severely B12 deficient. Anybody who has anemia, and we're going to get back to anemia because I didn't answer another question you asked. Anemia, anybody who has enlarged red blood cells, people age 60 and over just should be screened yearly for this.
How about kids?
Well, children, the signs and symptoms of B12 deficiency in infants and children, you have to remember they're going to present differently because they haven't acquired speech and language. But they have poor socialization, language delay, speech problems, and meaning like if a 1-year-old should be talking, a 2-year-old amount of words. Lower IQ, they will have apathy, irritability. They can lead up to seizures. They have gait problems. They can become anemic. They can become macrocytic.
Because we know that children are fed such horrible food most of the time. Unless the parents are really involved and take care of themselves, the children are probably eating junk.
The number one reason why a child is B12 deficient is because that mother, during her pregnancy, she did not have enough B12. See, we got to remember, this is not just an older person's disease. For instance, when I was in my 20s and I didn't get my doctors to test me for B12 deficiency and I would have been pregnant, I would have had a B12 deficient child, and it could be mentally retarded. We know in the literature from the 60s, when you look up cobalamin, another name for B12 is cobalamin, but B12 deficiency in infants and young children, they would do, they followed these children for a while. They would use the term that they became mentally retarded. They had like a brain injury from being B12 deficient. So it really does attack the brain. But the women, why these children were deficient is because during pregnancy or during breastfeeding, the mother had no idea she was B12 deficient, or she had or maybe like a lower B12, not a good, she had like lacking the B12. And when she breastfed, that child did not have enough stores. And you need B12 for the brain development and growth, and it's so critical during that period in child growth and development. So that's why any child with developmental delay that the physician feels or the parent feels should always be checked for B12 deficiency. To take it back one step further, women who are pregnant, who preconception and during pregnancy, we should be screening these women for B12 deficiency because we want to, not create any kind of injury in children. We have to start wondering this epidemic of autism. When you look at the signs and symptoms of autism and developmental delay, and you look at the signs and symptoms that's documented in medical textbooks for B12 deficiency in pediatrics, they are very similar. Therefore, instead of just saying, I think he's on the autism spectrum, please check the child for a B12 deficiency. And once you learn the risk factors and the signs and the symptoms, and you go back and start asking the mother, etc., you will see patterns, and they should be screened. And you cannot, and this is the mistake the physician makes, you cannot go by a complete blood count looking for anemia or macrocytosis because you're not going to see it. And this is the question I didn't answer before. You had asked, is there a confusion between folic acid and B12?
Yes.
When they do a blood count, what they're looking for is anemia, which B12 deficiency definitely can cause, and they're looking for these enlarged red blood cells. If you take enough folic acid by supplement or in foods, in 1998 we refortified all our cereal and grain in the U.S. to prevent birth defects in infants and children. So we're getting a lot of folic acid, and when women are pregnant, they have fortified the vitamins with a lot of folic acid so they won't get spina bifida or birth defects. Okay, so these women are on high-dose folic acid. when a person takes enough folic acid,